Hey, veterans and families, it's Craig here from Royal Rock Counseling and Consulting, and welcome to our featured topic for the month of November: 30 VA claims in 30 days. And make sure to mark your calendars because on November the 11th, I'm going live right here on this channel to answer frequently asked questions about VA claims and conditions across the web. To make sure you're fully equipped, I'm going to offer two resources that I use with veterans every day. The first resource that I'm going to offer is the three-stage VA Claim Playbook, your step-by-step guide to understanding, organizing, and strengthening your claim. The second resource I'm offering for free is the Mental Status Examination Assessment Decision Tree. This tool is a simple but powerful tool to help you understand how mental health evaluations impact your claim. Together, these are the only two documents you'll need to successfully file and win your VA claim. So hit that subscribe button, tap the notification bell, and don't miss a single day of this series. Now, let me remind you that the content in this series is for educational purposes only. It's not intended for legal, clinical, or medical advice, and there's no therapist or client relationship established. Royal Rock Counseling and Consulting LLC is not a VA accredited agent, attorney, or Veterans Service Organization, and it's not affiliated with the Department of Veterans Affairs. We do not prepare, present, or prosecute VA claims, but may provide administrative guidance and referrals to qualified professionals. Vets and families, I'm honored to walk with you through this process, helping you move from confusion to confidence. So let's get started. Okay, vets and families, now we're going to get into a VA claim condition that a lot of veterans, I think, have a problem understanding, or they find it difficult to understand, and they hear it a lot, and they don't fully get what it all entails. And so we're going to break it down a little bit today. And that claim condition is chronic fatigue syndrome, or CFS. Very important to note that chronic fatigue syndrome is something that is very different than just having fatigue or being tired or being exhausted. And we're going to learn a little bit more about what that means today, particularly as it relates to your VA claim. So it's described as chronic fatigue syndrome, and it's listed under 38 CFR 4.88 alpha. It qualifies as a debilitating fatigue, reduced daily activity to less than 50% of normal for 6 months or more. And then it's a requirement of six or more of the 10 listed symptoms in 38 CFR 4.88. We're going to actually, in the next slide, go over those 10 symptoms. And you have to meet at least six of those symptoms for 6 months or more in order to be considered as having met the criteria for chronic fatigue syndrome. Also important to note that chronic fatigue syndrome is a multi-system condition, and it's not just being tired. I mentioned that earlier. It's not that just that you're exhausted or you had a really, really long day and you're just tired from all of the work that you did, or maybe you went to the gym after that, or maybe you did some other things, met with your family, or just had an exhausting day. That is not chronic fatigue syndrome. It has to meet these criteria. It has to have specific symptoms, and it has to last for over a certain amount of time. And just in case there was any confusion as to what those symptoms are, I've pulled them for you right out of the 38 CFR 4.88 alpha. And here are the 10 listed symptoms that you must meet. You must have this criteria in order to be considered a candidate, let's say, for chronic fatigue syndrome. There has to be an acute onset of the condition. That means it arose right out of the blue and you started experiencing some situation of these 10 symptoms. So one symptom is that the fatigue is acute. And then the next one is low grade fever, meaning, you don't have a fever that's out the roof, but you definitely have a fever as measured by appropriate devices, and it's low grade. Non-exudative pharyngitis, meaning like there's just that esophageal condition of pharyngitis that you're exhibiting. Palpable or tendal cervical or axillary lymph nodes. That's these things right here. Um, palpable or tender. And these are, again, it's six of these, right? So six of these happening at the same time for you that is diagnosed and observable, either by your own documented evidence as far as what you're feeling, the symptoms that you were feeling, or diagnosed by a qualified medical professional. Generalized muscle aches or weaknesses. Now, here's the thing. A lot of people, when they get muscle aches and weaknesses, they say that's chronic fatigue syndrome, but that's just one of them. And I've heard a lot of veterans talk about how they feel achy or weak or painful just in their muscle and tendons and joints. That is definitely something to be considered and checked out by a doctor, but it doesn't necessarily mean that it's a qualifies or meets the level of chronic fatigue syndrome. So, muscle weakness, muscle aching is part of this 10 symptom list where you need to meet at least five more if that's how you're feeling. Fatigue lasting 24 hours or longer after exercise, headaches of a type, severity, or pattern that is different from headaches in the premorbid state. Okay, different from headaches in the premorbid state, meaning the state before you get into this sort of flux of symptomology, right? It has to be a pattern that's different from that, right? If you're just having normal headaches under normal circumstances, maybe a tension headache or a stress headache, that doesn't meet this criteria. It has to be different, right? Type, severity, or pattern, meaning the frequency with which you have them is different. The type of headache is more of a migraine or it's more heavier. The severity of the headache is more painful. Okay. Those are things that may rise to the level of chronic fatigue syndrome, along with those other symptoms. And then migratory joint pains, meaning joint pain that just moves around, it doesn't stay in one place. Neuropsychological symptoms, that's in the head. If you're having, say, illness, anxiety disorder, in addition to some of these symptoms, then you may be able to claim illness, anxiety disorder as a secondary condition to chronic fatigue syndrome, or vice versa. And that would be considered a neuropsychologic symptom. Another example would be if you have depression, major depressive disorder, mood anxiety depressive disorder, along with some five of those other symptoms, you could be a candidate for CFS. And then the last one would be sleep disturbance. This would be nightmares, night terrors, night tremors, sleepwalking, any of those types of things that combine with five of those other symptoms. And then you could possibly be a candidate for CFS, but ensure that you get a qualified medical professional to check you out and see if you meet that criteria for this particular VA claim condition. Okay, guys, now here's another a good sort of rubric to use. It's always good to understand what the symptom severity levels are as they're tied to percentage levels so that you can have a better understanding of how your diagnosis meets the criteria or falls under the criteria of 38 CFR and what the VSR or RVSR may be looking at whenever they get your claim. So this is how the VA considers it on the rating scale. CFS is rated under Diagnostic Code 6354 as part of 4.88 Bravo infectious diseases. And the ratings range from 100%, which is nearly constant symptoms restricting routine activities, almost completely, occasionally bedridden. Pay attention here because we're talking now about activities of daily living being impaired, and we're also talking about functionality being impaired. You'll notice that the 100% level is always associated with something that's total or near constant, as this particular one says, right? That means more than 90% of the time, 99% of the time to 100% of the time, or if we want to talk in VA compensation claim rating table language, let's just say 95% or greater of the time, right? You have constant symptoms restricting all of your normal routine activities that you were able to do before you started experiencing symptomology of CFS. And so occasionally bedridden, meaning you just don't want to get up, stopping routine activities, you are not able to function. And that qualifies for the 100% level. Okay. So we really need to be honest about this. And these are things that can be observed from other people, right? The personal testimony of this is great. But if you can get somebody else who observes that to be the case, that may work well in your favor for getting this rated, right? And if you are experiencing these types of symptoms with regard to chronic fatigue syndrome, please make sure that you're receiving medical attention and help as often as possible so that you can keep those symptoms at bay, whether that's through the VA, through VA care, or through some other private medical treatment. 60% is debilitating symptoms, restricting routine activities to less than 50% of the normal. That means your capacity to be able to do these activities is less than really the satisfactory level or the mid level of 50%. Same types of things. It's just that you have a little bit more functionality at the 60% level. And then 40% symptoms reducing in reduced routine activities to 50 to 75% of normal, meaning you're 50 to, I mean, you're over halfway there. Okay. You're just still experiencing some of those aspects. And it's noticeable in your records, in the evidence you present, and in the diagnosis, and you're at 40%. 20% symptoms controlled by continuous medication or that wax and wane but restrict activity occasionally. If you look at all of these different rating criterias, right, a lot of these things are things that you'll have to tell the compensation and pension examiner about what's going on. So that's your story that you tell whenever you stand before the CMP examiner. Uh, Really important that they must rule out all other causes, and I want you to check the M21-1 guidance that overlaps with Gulf War undiagnosed illnesses. Some really good information in there. And then the M21-1, also some cases to refer to as well. And we'll go over case law here in just a second. Okay, so vets and families, before we go into case law, I wanted to make a quick note and say that when I was researching for this video, I noticed that the the guidelines and regulations and some of the requirements and restrictions for for Gulf War illness, or for this particular for CFS, for chronic fatigue syndrome, hadn't been updated since 1994. Now in 4.88 alpha, there is some more recent guidance on how to kind of deal through this, but I noticed that it's been a while since it's been updated. So I have some case law here that we'll go over in just a moment. But I wanted to say, and this is applicable to all of all of the claim guidance that you see in M21-1, which is the VA's internal guidance, informally. And then there's the 38 CFR, which is Title Code 38, which is law and statutory regulation. It's important to note that with all of these changes coming about, I remember I was listening to the hearing that happened on last week. I noticed that what they were talking about was that there needed to be an overhaul of a lot of the guidance for a lot of the VA claims, and that it had been outdated, and there had been so long since it was even reviewed to take a look and see whether it matched up to more modern science, more modern medical research. And so I want to say that that's coming, right? They're going to modernize how they look at a lot of these VA claims. So one of the things that we want to do on this channel is we want to make sure that the veteran at least has updated information and updated guidance. So as the VA releases these things, not in any kind of sort of clickbaity manner or not in any kind of sensationalistic manner, we just want to make sure that you have the most current, accurate, and complete and updated forms, procedures, guidelines, and all of those things. I'm going to try to stay on top of that as much as possible, do videos about it, particularly when the VA comes out with different updated guidelines and claims. Just wanted to drop that in there to let you know that a lot of these things are going to be overhauled, and I think that's coming down the pipeline very soon. So just something to be aware of. Gutierrez versus Principi in 2004 established that both war veterans don't need a formal medical diagnosis to qualify under 3.317 for undiagnosed illnesses. Stankovich versus Nicholson clarified the importance of lay evidence in demonstrating symptom persistence and impact. And then Jonah versus McDonald in 2014 emphasized that symptoms, not the diagnostic label, drive rating outcomes. That's a really important decision. If you're feeling it, then that's what verifies that you have it, whether diagnosed or undiagnosed, or seen at the CMP exam or observed by family, from friends or coworkers. So very important to look at this case law. And again, take this case law with a grain of salt. It has to be applicable to what you experienced and something similar to your own condition that you're trying to claim. Okay, so we're getting to the part of our video where we talk about evidentiary support strategy for post-service claim in the case of gulf war illness or undiagnosed illness, and CFS, things of that nature, where we're starting to get in there with regard to how we produce or how we build a post-service evidentiary claim for this particular condition. So medical evidence, we know we need primary care or specialist documentation confirming a chronic fatigue pattern. Remember, the the criteria is that it has to last for 6 months, right? So if you can establish a pattern over the course of 6 months, maybe it happened for a season over a 1 month, and then the symptoms died down and then it picked back up. You want to establish a pattern, whether that be through your own medical journal of your symptoms that you're experiencing, or otherwise you want to establish a pattern. Maybe someone saw it, definitely, and definitely you weren't around a medical professional long enough for it to be diagnosed as possible CFS. You want to make sure you include all of those. Exclusion of other medical conditions, thyroid, anemia, depression, right, that could cause that CFS, right? Those are rule out diagnoses when it comes to that, right? To say that, hey, listen, no, like these are these are not attributable to any other symptoms. This is chronic fatigue syndrome. We know that that's the reason why this particular veteran is having these problems. Test results, sleep studies, or lab work supporting fatigue etiology, meaning the root where it came from is CFS. Lay buddy statements describe the frequency and duration of the fatigue. Document your inability to perform daily or work related activities. And this can be from logs, duty logs. This can be from, like all of those things can be used as evidence. Duty logs, work logs, uh, poor performance activity while you were in the military as it relates to a sickness that you had. Anything observable by your subordinates, your peers, or your superiors about what was going on during the time. And, that can attribute to your chronic fatigue syndrome. You want to carry and you want to collect all of that evidence because all of it matters when it comes to trying to document your claim and trying to have evidence that is attributable to your claim. You want to document your inability to perform daily or work related activities. That's y'all been on my channel. Y'all know what's going on with that. Y'all know how we roll with regard to ADLs and functional impairment. Family and friends describing energy loss, sleep disruption, or cognitive decline. Those are all things that can be observed by other people who are close to you in your life who know you. Okay. Here are some service connection pathways. Gulf War veterans, those who served during that time, uh, can be presumptive under 3.317. Okay, make sure you take a really good look at that, right? Presumptive claims certainly do mean presumptive, but there are rules, regulations, and stipulations with regard to all of that. So make sure you check into that. We also did a video on this channel on presumptive claims, so make sure you go check that out on our channel. It's in the playlist for VA disability claims made easy. Other veterans, direct or secondary conditions like fibromyalgia, pay attention, PTSD, or infection. Now, that's a secondary claim, right, that you can claim to the primary claim of Gulf War. They used to call it Gulf War syndrome. It's chronic fatigue syndrome now, undiagnosed illness. This could also be tied into the MUMIC claim, those kinds of things. Bonus tip, always show post-exertional malaise. That's what it used to be called too. I don't know if it's still called malaise. I'll have to check into that. Fatigue after exercise/work and impact on functionality. Those are CFS clincher symptoms that the VA will always look for. These are some things to consider as you submit your VA claim for chronic fatigue syndrome. I hope you guys enjoyed this video. Thank you for watching. If you want any more information about the subject of this series, be sure to check out the playlist right here. And remember, live royally and live well. Thanks for watching, and I'll see you in the next one.